30 rounds. 30 rounds of radiation to my pelvis, which has left me barren and infertile. At 33, I am in menopause. Because when my tumor was a polyp, I did not have access to a family doctor. And the ERs wouldn't help me.
You may remember that video. Nova Scotia woman Inez Rutterham says she went undiagnosed with anal cancer for 2 years because she did not have access to a family doctor. It's a story that drew national attention. She requested and will receive a meeting with Nova Scotia Premier Stephen McNeil later this month. But we decided to look at the numbers across the country. And as it turns out, she isn't the only one. Right now, there are approximately 51,000 people in Nova Scotia, at least, living without a family doctor. And nationally, Statistics Canada estimates that 4.5 million people are without a family doctor, and most are between the ages of 20 and 34. Here's how it breaks down by province. In BC, 700,000 people don't have a family doctor. Alberta has a similar number. Saskatchewan has more than 200,000 residents without a regular doctor, and so too does Manitoba. In Ontario, that number jumps to over 1.3 million people. Even more in Quebec, with more than 2 million people. And in Atlantic Canada, the total number of people without a family doctor is about 175,000. That breaks down with 50,000 in New Brunswick, 12,000 in PEI, 50,000, as I said, in Nova Scotia, and 60,000 in Newfoundland and Labrador. So how do we fix this? We've put together a panel of doctors tonight to help brainstorm some solutions. In Halifax tonight, Dr. Tim Holland. He is the president of the Doctors Nova Scotia and a practicing family physician. In Toronto, Dr. Tara Kieran is a family physician at St. Mike's Hospital and the Fidani Chair of Improvement and Innovation at the University of Toronto. And in Vancouver, Dr. Rita McCracken. She is a clinical associate professor at the University of British Columbia. She's also a research director for Providence Healthcare. Good evening to you all.
Good evening.
Okay, let's go around the country and find out what the situation is where you are. And Tim, Dr. Tim Holland, I'm going to start with you.
Yeah. So, I mean, the statistics there are also sort of the lowest statistic. It's important to highlight that the 50,000 is the amount of people that are on the wait list for a family doctor. There's estimated to be about another 50,000 for a total of over 100,000 people in Nova Scotia without a family doctor. Either they've given up looking or just don't have any faith in the actual waitlist system. And so we're facing incredible tragedies here in Nova Scotia. And I mean, the video we just saw is a great example, an unfortunate example, but the perfect example of the challenges we're facing. I mean, this patient faced issues with the emergency room crisis. They faced challenges with the shortages in mental health, and of course, all along, didn't have the family doctor to help guide them through. And so it's a tragic case, but unfortunately, it's not the first time I've heard a story like that.
Yeah, Dr. Kieran, how about where you are in Toronto?
Yes, you know, there's actually been an improvement over the last 2 decades in Ontario, with more people now being able to find a family doctor. So even though I think that you guys quoted a million plus people without a doctor, which is
1.3 million in Ontario.
Which is really a large number. Actually 95% of people do have a family doctor, and that's actually a higher percentage than there was 2 decades ago. Now, of the people who don't have a family doctor, that's still a huge problem, and we also know it's more of a problem.
95%. So I'm just trying to reconcile the numbers. 1.3 million in Ontario.
So it probably depends on where you're getting your statistics. But
Statistics Canada.
Yeah. So I think if you ask, look at surveys where they've asked patients, do you have a family doctor? Using those surveys, they estimate about 95% have a family doctor. But you know, 90 to 95. Ontario is a big province, so 10%, 1.3 million.
Okay, so it's improved in Ontario. Dr. Rita McCracken. What about BC?
Well, in British Columbia, we estimate that about 1 in 6 British Columbians is unable to find a family doctor. We've seen quite an increase in the availability of episodic care, for example, walk-in clinics and urgent primary care centers. but we have seen a continuous decrease in the availability of your typical community-based primary care physician.
Okay, what does that mean exactly?
So if you imagine having a family doctor who knows you over a series of years, who you would go and see for bumps and bruises and also check in with for larger situations, might deliver your baby, those are the kinds of family doctors that 1 in 6 British Columbians are having trouble accessing.
Okay, so where do they go?
They go to walk-in clinics and to urgent primary care centers.
Okay.
And it's great that they're able to receive that kind of immediate treatment. But we know from research that one of the big values of primary care is that continuous relationship. And so we have a concern about replacing continuous care with episodic care.
Okay, so Ontario doesn't appear to have a problem from what we've heard from you, Dr. Karen. So what are you doing that has fixed this problem?
I think there's still many people in Ontario who don't have a family doctor. So I just want to put that on the table.
But
I think
95% do.
95% do. And
Wow.
I think the government has invested more over the last 2 decades in family medicine. They've made it more attractive to be in family medicine. For example,
okay.
they've invested in team-based care. So unfortunately, not everybody has access to that, but I know for many people who do, that's made actually practicing a lot better. They've changed the way family doctors are paid, so it's more attractive for family doctors.
Let's break that down. What is team-based care?
Yeah, so I'm really lucky. I work in a family health team. It's one of the team-based models in Ontario. So patients who I have, actually, they're connected to me and they can see me as their doctor. But for example, if I have a patient with diabetes and I'm not sure which medication that they should go on, or they want more information about medications, I can ask them to see my pharmacist. Or if I have someone who's struggling with mental health issues, they can see our social worker. We know so much of care, so many issues these days are complex and actually require a team approach. And so I think having these access to team-based care has actually really helped make family medicine a really attractive career for family doctors.
Okay, and the money portion?
Yeah, so I think the Ontario government did invest in changing the way that we were paid. That's not been the case for every family doctor in the province, but many have now moved to a system where we're not paid just pay by the visit or fee for service, which is the predominant model across Canada. But we're paid by the patient per year based on their age and sex. And that actually is a way where we can be more proactive and often spend more time with patients trying to deal with complex issues.
Okay, now, give me an example of that, where you're paid by the fee for service versus paid by the patient.
Yeah.
Paid by the patient per year.
So you get paid, for example, if you have someone who's 50, a 50-year-old woman, you get paid based on the fact that you have a patient who's a 50-year-old woman in your practice, not how many times that patient comes in to visit you. So it gives you more flexibility, for example, to do work by the phone, by email. It also gives you more flexibility to deal with many problems in one visit, book half-hour appointments. So it's really, I find it a nice way to get paid. Now, it's not, no payment model is perfect. And I will say also, there has been a lot of struggles between the ministry and the Ontario Medical Association of late. And that's actually impacted then the number of medical students choosing family medicine more recently, because I think people are worried about those options being open to them.
Okay, so you get paid more if you have a 50-year-old woman in your practice for that patient.
I think it's more that we get paid differently. Okay. So you get paid differently.
You end up making more money than, let's say, in Nova Scotia. So a Nova Scotia physician. I actually haven't done the direct comparison, but I suspect that certain family doctors in Ontario who are paid by capitation probably are doing better than their colleagues in Nova Scotia. Dr. Tim Holland, what do you think is the answer for Nova Scotia? Does the team-based model sound good to you?
Brooke, and I can say that it works when it works well. You have to have the right chemistry between people. But for Nova Scotia, I can confirm that Nova Scotian family doctors are paid considerably less than those in Ontario. And so that is a big challenge in Nova Scotia, where our family doctors are paid amongst the lowest in Canada. And so it is a challenge.
How much does the average family doctor make in Nova Scotia?
It varies depending on which jurisdiction you're in, whether you're urban and what payment model you're in. But we're generally going to be, compared to like our neighbors in New Brunswick and PEI, we're paid between, $30,000 to $50,000 less, and then, less when we compare ourselves to some of the higher paying areas like Alberta and Ontario. However, we are looking at compensation models similar to the one described in Ontario, where you're paid per patient in your roster, and I've been a big advocate for a change towards that. And so, that's one part of the solution, compensation another, but as well, non-monetary things like engagement of physicians in healthcare decisions and changing the environment to be more respectful in terms of the way government addresses physician concerns, reducing bureaucracy, red tape reduction. These sorts of things would go a long way to making Nova Scotia at least a more attractive place for family physicians to practice.
Where has the disrespect shown up?
Well, in multiple ways. So for one, there's an audit process. So every year, a few doctors are sort of looked at and their billings are reviewed by government to see if they're doing their billing appropriately. Most times when it's not done appropriately, it's a clerical error. It's not understanding where to enter certain data points. It's not the work wasn't done. It's that the physicians just didn't know how to register it. However, this audit process in Nova Scotia is treated in a very punitive manner. Physicians are assumed to be fraudulent or assumed to be criminal at the outset, and this creates a very hostile environment. So I would advocate that the first time a physician is audited, have it be educational. If it's the second time or they're obviously fraudulent, well, that's a different story.
Are you losing doctors because of that?
That's one of the reasons, and so we unfortunately, Nova Scotia has earned a bit of a reputation for being a bit of a hostile environment in that regard, and we see physicians leaving for reasons like that they don't feel respected by government and they feel like this isn't a great place to be. That said, we are working very closely with government in improving this, and there have been a few positive steps, and so I'm cautiously optimistic that things like that audit process are going to change and that physician engagement will change, but we really need to see some big steps to make this a more hospitable environment for family doctors.
Okay, would you say the priority is more money?
No, I mean, money's part of the equation, but I mean, it's hard for me to pick out one certain part, but I think that for a lot of physicians I speak to, the work environment, the bureaucracy they're dealing with, these are just as important to money, if not more important in a lot of ways. Because in the end of the day, I'm a family doctor. I want to do the right thing for my patient, and if I can't do that, if I have paperwork standing in my way, or I've got red tape getting in the way of my ability to deliver good care, that's going to frustrate me, because that's what I went to family medicine for, is to do the best thing for my patients.
Dr. McCracken, what's BC doing?
Well,
and what are the ideas out there?
So in BC, the vast majority of primary care is delivered through the fee-for-service model, and we are hearing loud and clear. I did some research over the last couple of years that shows that at least 50% of family doctors are interested in changing to a model like Dr. Kieran has described. The other thing that we're noticing here in BC is that family doctors are getting offered jobs outside of a community clinic. So they're doing work in emergency rooms, in hospitals, providing care for people with addiction. So really important work within the system, but work that takes them out of being able to provide primary care services. And our preliminary assessment of that is that the job environment that they are being offered in those places is more attractive, similar to what Dr. Holland and Dr. Kieran have already said. This is team-based care where the burden of running your own business is removed. And so we are looking right now, there's some very interesting work that has been initiated by the Ministry of Health around creating opportunities for team-based care, but we're still very early days in that. We don't have any practical examples to look to just yet.
Yeah, and how are you trying to set those up? As I understand from the website, there's some models where you're actually offering a financial incentive for doctors and professionals, healthcare professionals, to set up these teams.
So again, the specifics are still very early, and I don't think anybody could give you a very specific answer. We do have history in British Columbia of providing incentive payments to try to promote different behavior. And what we saw is a furthering of the excellent quality of care that was already being done, but we did not see an increase in capacity. So we didn't see more people being able to see more patients. In fact, we saw the opposite. We saw people seeing the same people more often and therefore taking on fewer new patients.
Okay, but you're not seeing that in Ontario, Dr. Kieran.
Well, you know, I think that it's important to highlight that there are certain groups and certain regions of Ontario that are still quite underserved. You know, there are many rural communities that have a hard time recruiting and retaining family doctors. There are also, you know, when we look at the proportion of patients who have a family doctor, we see that patients who are actually immigrated here in the last 10 years are much less likely to have a family doctor than those who have lived here for a while. So we're not doing a great job connecting newcomers. And we know even within big cities, there are these clusters of people who have high healthcare needs, you know, because maybe they're living with lower income, have more mental health and addictions issues. And in those regions where there's more of those people, there are actually some less doctors. And so areas in Toronto like Scarborough or northwest of Toronto actually have fewer doctors that they should based on the healthcare need of their population. So we need to do better and actually target kind of recruitment and retention in specific areas and for specific populations.
All right, well, that's all the time we have. I want to thank you all for weighing in. In Halifax, Dr. Tim Holland is the president of Doctors Nova Scotia. In Vancouver, Dr. Rita McCracken is a clinical associate professor at the University of British Columbia. And in Toronto, Dr. Tara Kieran, a family doctor at St. Michael's Hospital. We started the conversation about what can help, and hopefully there will be some more ideas and this problem will be solved at some point. Thank you all very much.
Thank you, Carol.
Thank you.